So here I am using a soft tip irrigation and aspiration handpiece. I remove the anterior chamber viscoelastic as best as possible. I like to do that to create space for the lens and to make sure that there's more space for the intraocular viscoelastic to move forward. The teaching is usually to go under the IOL first, but I like to remove the viscoelastic above so that when I go down, it's easier for the viscoelastic to move anteriorly. No? So you can see the toric markings. Now I'm gonna go and use a single-handed technique. I don't use a second instrument. I just use the soft tip to go under. Regular teaching would be to use a second instrument to mobilize the lens. There's no need for that with a soft tip INA. So once it's vacated, the viscoelastic vacated, you partially mobilize the lens. You can see that we're around 15-20 degrees away from our final axis. You can now use the soft tip to rotate through the elbow of the haptics, the haptic optic junction. I do that slowly in increments of 10-20 degrees each until I get a pretty good alignment between 3 to 5 degrees prior to my final or resting point. I press down on the optic. There's no fear in scratching the optic because I'm using a soft tip. I press down on it while I'm aspirating and I'm finalizing the alignment. As you can see, the corneal marking on each side is aligned with the IOL marks. So it's pretty good. So long as you are around 3 degrees before your endpoint or on your endpoint, depending on your technique, you should be fine. You should never be over your endpoint because it does rotate around 3 degrees. I always use a cotton tip applicator to block my exit. And you can see the chamber does not shallow. That's important in placing a toric IOL. You should have a good seal so that when you remove your INA tip, your chamber doesn't shallow, because during the shallowing part, that is when you actually have a rotation. Check out the capsular rhexis. It's a little smaller than the optic edge or than the IOL optic, and you see the alignment is pretty good. So that is things that would help. I seal the triple wang. I check if it's dry. If it's dry, then we're at the end of the case. We just place in our intraocular antibiotics.